Chikungunya is a disease transmitted to humans by mosquitoes in Africa, Asia, and the Americas. Dengue and Zika have similar symptoms to chikungunya, making chikungunya easy to misdiagnose. Chikungunya causes fever and severe joint pain, which is often debilitating and varies in duration. Other symptoms include joint swelling, muscle pain, headache, nausea, fatigue and rash. There is currently no approved vaccine or specific treatment for chikungunya virus infections, due to the challenges in reporting and diagnosis. The number of people affected by chikungunya is underestimated. Severe symptoms and deaths from chikungunya are rare and usually related to other coexisting health problems. Chikungunya is a mosquito-borne viral disease caused by the chikungunya virus, CHIKV, an RNA virus in the alphavirus genus of the family Togaviridae. The name chikungunya derives from a word in the Kimikand language, meaning to become contorted. Transmission. Chikungunya virus is transmitted by mosquitoes, most commonly Aedes, Stegomyia aegypti and Aedes, Stegomyia albopictus, which can also transmit dengue and Zika viruses. These mosquitoes bite primarily during daylight hours. They lay eggs in containers with standing water. Both species feed outdoors, and Aedes aegypti also feeds indoors. When an uninfected mosquito feeds on a person who has CHIKV circulating in their blood, the mosquito can ingest the virus. The virus then replicates in the mosquito over several days, gets to its salivary glands, and can be transmitted into a new human host when the mosquito bites them. The virus again begins to replicate in this newly infected person and reaches high concentrations in their blood, at which point they can further infect other mosquitoes and perpetuate the transmission cycle. Symptoms. In symptomatic patients, CHIKV disease onset is typically 4 to 8 days, range 2-12 days, after the bite of an infected mosquito. It is characterized by an abrupt onset of fever, frequently accompanied by severe joint pain. The joint pain is often debilitating and usually lasts for a few days but may be prolonged, lasting for weeks, months or even years. Other common signs and symptoms include joint swelling, muscle pain, headache, nausea, fatigue and rash. Since these symptoms overlap with other infections, including those with dengue and Zika viruses, cases can be misdiagnosed. In the absence of significant joint pain, symptoms in infected individuals are usually mild and the infection may go unrecognized. Most patients recover fully from the infection. However, occasional cases of eye, heart, and neurological complications have been reported with CHIKV infections. Patients at extremes of the age spectrum are at higher risk for severe disease. Newborns infected during delivery and older people with underlying medical conditions may become severely ill, and CHIKV infection can increase the risk of death. Once an individual is recovered, available evidence suggests they are likely to be immune from future infections. Diagnostics. Chikungunya virus may be detected directly in blood samples collected during the first week of illness using tests such as reverse transcriptase polymerase chain reaction, RT-PCR. Other tests can detect a person's immune response to chikungunya virus infection. These are typically used after the first week of infection to test for antibodies to the virus. The antibody levels are typically detectable by the first week after illness onset and can still be detected for about 2 months. Treatment and vaccines. The clinical management includes addressing fever and joint pain with antipyretics and optimal analgesics, drinking plenty of fluids and general rest. There is no specific antiviral drug treatment for CHIKV infections. Paracetamol or acetaminophen are recommended for pain relief and reducing fever until dengue infections are ruled out, as non-steroidal anti-inflammatory drugs NSAIDs can increase the risk of bleeding. While there are several vaccines currently in different stages of development, as of DEC 2022, they are yet to be licensed. There is no commercial vaccine available to protect against chikungunya virus infection. Prevention and control. Prevention of infection by avoiding mosquito bites is the best protection. Patients suspected of having CHIKV infection should avoid getting mosquito bites during the first week of illness to prevent further transmission to mosquitoes, who may in turn infect other people. The main method to reduce transmission of CHIKV is through control of the mosquito vectors. This requires mobilization of communities, who are critical in reducing mosquito breeding sites through emptying and cleaning containers that contain water on a weekly basis, disposing of waste, and supporting local mosquito control programs. During outbreaks, insecticides may be sprayed to kill flying adult mosquitoes, applied to surfaces in and around containers where the mosquitoes land, and used to treat water in containers to kill the immature larvae. This may also be performed by health authorities as an emergency measure to control the mosquito population. For protection during outbreaks of chikungunya, clothing which minimizes skin exposure to the day-biting vectors is advised. Window and door screens should be used to prevent mosquitoes from entering homes. Repellents can be applied to exposed skin or to clothing in strict accordance with product label instructions. Repellents should contain IR 3535 or icaridin. Insecticide-treated mosquito nets should be used against day-biting mosquitoes by persons who sleep during the daytime, for example young children, sick patients or older people. People traveling to areas of active CHIKV transmission should apply basic precautions including the use of insect repellents, wearing long sleeves and pants and ensuring rooms are fitted with screens to prevent mosquitoes from entering.